Hey everyone, it is Dr. Endel with Westerville Chiropractic and Nutrition, and I am posting a shorter podcast episode up the ladder today, and I just wanted to share some interesting insights on a really interesting article that I just read entitled Relationships Between Hyperinsulinemia, Magnesium, Vitamin D, Thrombosis, and COVID-19, Rationale for Clinical Management. And so while this does relate to COVID-19, people's risk factors, and it discusses possible interventions, I am by no means indicating that these are what you should do to manage COVID-19. I would leave that up to you, between you and your doctor. If you believe you have COVID-19, please reach out to the proper physicians and get guidance for that. However, there's a lot of insights based on this article about that could lead to prevention and or just helping to be more healthier in case that you would happen to contract COVID-19. And so the article talks a lot about hyperinsulinemia, which essentially is you're going to have high blood sugars, and so in response to that, your body produces more insulin. So that's hyperinsulinemia. They go over, of course, the risk factors with COVID-19 are over the age of 65. More importantly, though, and as we're learning more recently, it has a lot more to do with other types of comorbidities or risk factors as well, such as type 2 diabetes. And of course, as we all know, the ethnic minorities also plays another factor in that. However, hyperinsulinemia probably drives the biggest risk factor according to this article, that can be managed. It's hard to change your genetics and where you're from, but controlling your insulin and blood sugars can be an important part in, number one, keeping yourself healthy, looking at longevity, and of course, protecting yourself. So things that are related to an increased comorbidities that they are describing right now are obesity, cardiovascular disease, heart disease, people who have had stroke or are at risk for stroke, type 2 diabetes, and hypertension. So those are the biggest comorbidities that are happening right now. They're also the biggest risk factors that lead to chronic, debilitating, degenerative conditions later in life. And so besides potentially protecting yourself from COVID-19, protecting yourself from getting these things in the first place, or if you have them, doing everything that you can to reverse them, is critically important, not only for what's happening right now, but for your health and longevity in general. And no surprise here, one of the biggest things that they are recommending to drive changes in these things, again, obesity, cardiovascular disease, heart failure or heart disease, risk for stroke, type 2 diabetes, and hypertension, is going to be carbohydrate restriction, or more specifically, managing glucose levels. And the two big ways that they talk about doing that in this article, number one is to limit glucose consumption or carbohydrate consumption, which then gets converted to glucose. They also talk about if you are more specifically to the management of COVID-19, they're recommending that if you are a type 2 diabetic on insulin, they are recommending that you potentially increase your insulin to drive down glucose even further. However, again, this is a study for physicians dealing with the management of COVID-19. So I'm going to stay away from that because that is not my ballpark. However, that's what they mentioned. So essentially, two ways to reduce glucose in your body. Number one is take less of it, consume less carbohydrates. The other way is to increase insulin in the short term so that your glucose will go down. Again, that's management. That is not a long-term strategy because, again, that produces hyperinsulinemia down the road, which will lead to these other types of conditions. So kind of a subtle difference there. So long-term longevity health perspective, you want to limit carbohydrate and glucose consumption. Big ways that they're talking about doing that are, again, carb restriction, ketogenic-like diet. If you've heard any of my stuff in the past, I'm not a huge fan of strict ketogenic diets, but ketogenic-like diets, there's some modifications that you can do. Another is a fasting mimicking diet. So in our office we use Prolon, which is a 5-day fasting mimicking diet. And there's research that they've had come out showing that taking or doing the fasting mimicking diet for 5 days, 3 months in a row, is equivalent to doing 6 months on a Mediterranean diet. So very potent, very powerful, doing 5-day fasting mimicking diets several months in a row. As they're talking about, in their case, looking at immunity and overall longevity and health, with carbohydrate restriction, they did not tackle caloric restriction. Now, looking at again, reducing blood glucose levels if obesity and weight is an issue for you. Of course, adding caloric restriction safely to some extent can also be super beneficial in managing insulin response in the long term. So again, you want to talk to somebody about the proper and best way to do that. We're happy to do that. We're happy to be that person you talk to. But if you have questions on that or what that means, please reach out. The last thing that they recommended, which I thought was also very interesting, was adding magnesium oxide or magnesium chloride to your diet through supplementation, because people who are on metformin or other medications that lower blood glucose levels tend to rob the body of magnesium. And so from a health longevity perspective, and also managing side effects of these medications, adding magnesium oxide, magnesium chloride could be beneficial in that, as well as vitamin D, and in this case zinc. Those were more for the immune system and related to COVID. I'm a big fan of taking vitamin D in general for, as maintenance, and especially just living in Ohio. I think pretty much everyone should be taking, vitamin D to some extent most of the time through the year. But I thought it was especially interesting, the relationship between high A1C, taking medications, and how your body responds to magnesium. So that's going to be something that we look at in the future and dive into a little bit more, is adding magnesium for those people who are losing weight and need to manage blood glucose and A1C levels. So again, super interesting article in Open Heart 2020, relationships between hyperinsulinaemia, magnesium, vitamin D, COVID-19, a rationale for clinical management. It's very clinically based, but feel free to take a look for it for yourself. If you have any questions, happy to help. Otherwise, we'll see you later. Thanks.